Hello everyone, I'm Stephanie Gonzalez,
And I'm Shiksiri Nahosa.
and we will be speaking to you about mask mouth. In the past 2 years, wearing masks has been globally adopted to prevent the spread of COVID-19. As months led to years, many healthcare professionals as well as the general public have noticed changes occurring orally and systemically due to wearing a mask for extended periods of time. So what is mask mouth? Well, it would be said that an individual has mask mouth in the presence of these newfound adverse effects and symptoms, when it is primarily caused by prolonged mask use. Even with mask mandates being lifted, certain populations will continue to wear masks, such as individuals with allergies, seasonal asthma, immunocompromised individuals, and healthcare workers. So maintaining mask mouth is still a very relevant topic.
The information presented today was collected and analyzed through literature review research. The research in question encapsulated oral and systemic effects of wearing a mask for prolonged periods of time. People with mask mouth may experience individually or in combination systemic conditions, dermatologic effects, and new or worsened oral conditions.
One of the most obvious effects of wearing a mask for prolonged periods of time is difficulty in altered breathing. This too is accompanied by other consequences. Due to the obstruction in limited fresh air pathway and decreased fluid intake that occurs with mask use, difficulty breathing leads to mouth breathing, causing xerostomia. The reduced salivary flow and fluid intake results in less efficient elimination of food debris and less saliva available to buffer the acidic pH of caries, causing microorganisms and plaque buildup, resulting in caries, halitosis, and/or worsened new gingival conditions. Reduced water intake reaching dehydration levels can also be associated with headaches occurring with mask use. Embedded bacteria can be held accountable for halitosis, respiratory flare-ups in individuals who suffer from a pre-existing respiratory condition, or the creation of new ones. When an individual does not change their mask frequently, bacteria harboring inside the mouth is embedded into the mask itself upon expiration. The foul smell of an old mask can be quite unpleasant. Due to this embedded bacteria and the close proximity to the mask results in halitosis. For those who suffer from a pre-existing respiratory condition, the bacteria being inhaled into the lungs from the mask itself can induce respiratory flare-ups, triggering pre-existing conditions or creating of new ones. The embedded bacteria on the face mask is exposed to a warm and wet environment, ideal for bacterial growth during mask wear. The bacteria contacts the skin, causing irritation, which results in acne, angular colitis, or ulcers at the corners of the mouth, especially for geriatric patients.
Lastly, carbon dioxide accumulation occurs over prolonged mask use and can be held responsible for several systemic conditions. In a laboratory setting, 3 different types of masks, such as N95, cloth, and surgical, were tested at 3 different activity levels to measure the levels of carbon dioxide buildup. The study concluded a baseline of 500 ppm of carbon dioxide occurs without mask wear, and that 2,500 parts per million occurs during prolonged mask use. That's a total increase of 2,000 parts per million of carbon dioxide level buildup. The increase of 2,000 parts per million found in masks was considered non-toxic. However, 40 to 81% of healthcare workers experienced symptoms such as headaches, confusion, and fatigue. Additionally, the increased levels of carbon dioxide lead to a lowered oral pH, which can induce bacterial incubation, leading to possible dental decay and worsened periodontal conditions. So as you can see, it's all connected. It's not a given that all symptoms examined here would be present in a patient simultaneously in every case. However, symptoms can be intertwined and one can lead to another and vice versa, causing serious misfortune, especially in immunocompromised individuals. So what can we do about it? Despite these unfortunate findings, you should not stop wearing your face mask. As healthcare workers, the benefits of using a mask outweigh the cons of prolonged mask use. Instead, here are a few recommendations for both healthcare workers and our patients. As healthcare workers, you should change your mask for every patient or frequently and assess your own signs and symptoms. When fulfilling patient care, implement prolonged mask use into Canberra Caries assessments. Recommend saliva substitutes and xylitol products if your patient displays xerostomia and/or mouth breathing. recommend and apply neutral fluoride, and recommend pH neutralizing products as well. For both healthcare workers and patient recommendations, we suggest that you drink water regularly, take mask breaks, meaning that you take a step outside to remove your mask and get a breath of fresh air, and wash your face daily. Altogether, these recommendations help combat the manifestations of prolonged mask use.
A varied and a myriad of study findings on prolonged mask wearing all confirm similar unfortunate results. The research concludes that one negative symptom caused by prolonged mask use can lead to several other harmful or undesired effects. These symptoms all correlate to one another and directly affect the oral health. In sum, a solid basis is well established that supports the claim that prolonged mask wear will result in one or many negative oral systemic symptoms. Further research should be conducted since prolonged mask and daily wearing is a relatively new normal. Recommended further research topics should include the severity of symptoms resulting from different types of masks, the average time or frequency necessary to clinically display symptoms, and the viable preventative methods.
Thank you for taking time to listen to our findings. We hope that you join us in combating mask mouth moving forward.